Hello. In this lecture on systematic approach to ECGs, we're going to talk about rhythm analysis. So we've already talked about how to obtain the rate rapidly. Now we're going to talk about the rhythm. And the rhythm is actually probably the area that most providers get confused or feel a little bit uncomfortable with or make mistakes. But if we use a systematic approach and do the same thing every time, we can be accurate the vast majority of the time on determining the rhythm when we look at an ECG. And so we'll ask this series of questions, and really there's 3 questions with a couple of follow-up questions if necessary for the third. And then we apply these questions to our rhythm identification algorithm to help us narrow our differential to just a couple of different rhythms that we then have to choose from. So let's go through and look at some examples. What is the rhythm on this ECG? Well, if we start and just try to start looking at it and we don't have a systematic approach, it can be quite intimidating. But let's break it down to our key questions to determine the rhythm. First, is the QRS wide or narrow? Secondly, is the QRS regular or irregular? Third, are there P waves present? And if there are P waves present, our 2 follow-up questions. Are there a P wave before every QRS complex? And is there a P wave, is the P wave initiating or coming from the sinus node? Because that's going to be the most common rhythm we see, sinus. So our first question, a wide QRS. Well, we have to know what the definition of a wide QRS then is to answer whether it's wide or narrow. A QRS complex in an adult of greater than 0.1 seconds or 100 milliseconds is considered wide. In a child, it's often 80 milliseconds. So in this ECG, our first question, is the QRS wide or narrow? Well, just looking at it, the QRS looks narrow. And we can confirm that by looking at a specific lead and counting the number of small boxes. And here you can see that the QRS complex encompasses about 2 small boxes. And we know that 2 small boxes is 80 milliseconds because each small box is 40 milliseconds. So we know that this is a narrow QRS complex. It's less than 100 milliseconds. So on our rhythm identification algorithm, we go down and we say we have a narrow QRS complex. And then we go to our second question, looking at the ECG. Are the QRSs regular or are they irregular? And what I mean by that is the spacing between them regular or irregular? And if you look at this, you can see that they look like they're coming in very regular intervals. So what we look at to determine this is looking at what's called the RR interval, or the distance between 2 different QRS complexes. And so we're going to take this RR interval. It's the simplest way to determine if it's regular or irregular. Are the RR intervals staying the same? Now we do allow for a small amount of fluctuation in the RR intervals and still would consider it regular. So if we have 120 milliseconds or 3 small boxes as the greatest difference between the largest RR interval and the smallest RR interval on an ECG, we would still say that that is a regular rhythm. So in this case, on our ECG, we decided it was regular. So we're now down to this subgroupings. And our next question, which is, are there P waves present? Well, if you look at the rhythm strip at the bottom of the ECG, you can see that there's clearly P waves present. And then we have our follow-up question, is there a P wave preceding or before every QRS? And the answer is yes, it appears there's a P wave preceding every QRS complex. So we have P waves, and now we're into the box, and our options are, is it sinus, which is most likely, is it atrial flutter, or is it a junctional rhythm where you can actually see the P wave, which is going to be fairly uncommon, but could be possible. So how do we figure that out? And that's based on our second follow-up question, which is, if there are P waves, is the P wave axis normal? Remember that the P wave shows the atrial depolarization. So what we want to know is the electrical current through the atria being conducted in a normal fashion from the sinoatrial node to the AV node? And by looking at the P wave axis, we can help determine that. And there's a very simple question we can ask ourselves to figure that out, which is, are the P waves upright in lead 2 and are they down in AVR? So in a normal sinus rhythm, the P waves will be upright in lead 2, as shown here, and they will be down in AVR. So here is them being upright, and here is them being down. And so we know, looking at this ECG, we've asked a series of very simple questions and determined that this ECG shows a sinus rhythm. So in summary, our rhythm analysis on ECG, we're going to ask if the QRS is wide or narrow. We're going to figure out if the QRS complexes are regular or irregular. We're going to ask if P waves are present, and if so, we're going to have 2 follow-up questions. Is there a P wave before every QRS? And is the P wave coming from the sinus node? Meaning, is it up in 2 and down in AVR? Thank you.